Beauty is confidence and empowerment. It's when you can look in the mirror and see your reflection showing transformation, restoration, feeling empowered.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Venetia Neal, who's an aesthetic nurse practitioner and founder of Beauty Enhanced Med Spa, where she focuses on corrective regenerative treatments designed to deliver real results. With advanced expertise in skin of color and inclusive care for all skin tones, she blends clinical precision with personalized treatment planning to help patients achieve healthy, confident skin. So Venetia, welcome and glad to have you here.
Thank you for having me, Daniel.
Yeah, so let's start at the very top, Venetia. How did you first get interested in the medical field?
All right, so for me, I grew up in a small community in Jamaica, and my family and my church were dedicated to helping others in the community, the sick, elderly, and it became natural for me wanting to help others. So then when I started pursuing my career, then I chose nursing, and it's been fulfilling for me.
Okay. So when you got into nursing, did you already know you wanted to get into aesthetics, or was that something that you got into nursing first and then along the line you realized you liked aesthetics?
I did nursing for some time, and then I did my nurse practitioner, became a family provider at a underserved community primary care. And after I had my daughter and I wanted to find more work-life balance, then I discovered aesthetics and I was hooked. Because
Mm.
prior to my nursing career, I was a cosmetologist. So once I discovered aesthetics, it was the perfect way for me to merge my passion for beauty and then my knowledge and expertise in healthcare.
Okay. And so what led you to decide to start your own practice? I mean, why not just keep working somewhere else? What led you to want to start your own practice?
So I always wanted to provide comprehensive care for clients who are struggling with skincare concern. Because during my primary care rotation and primary care career as a family practitioner, I treated skin conditions like acne, hyperpigmentation, and I noticed how severely it affected self-confidence.
Mhm.
So once I discovered aesthetics, I figured this would be a great place for me to create a safe haven where all skin types and tone with different skin condition that's affecting their confidence could be treated. So I do corrective skincare to help to boost confidence and help overall empowering others.
Okay. So now that you have this practice, I want to go into some of the treatments that you provide. One is the Aerolase Laser. Could you tell me a little bit what is the Aerolase Laser and what does it help with?
So Aerolase Laser is a YAG 1064. So what this means, it's a non-ablative, so it's safe for all skin types. It's FDA approved to treat over 36 skin concerns. So acne scarring, hyperpigmentation, skin rejuvenation, hair removal, and like I said, this is safe for all skin type, and it can be the foundation for a lot of treatment plans. It is safe to combine with several other modalities like um, medical skincare, microneedling, and other aesthetic procedures.
Now, is it painful? I'm sure you get a lot of clients asking about that.
Yeah, that's a good question. I just had that question earlier today. So it is anywhere described from the feeling of a blow dryer on the skin to just warm drops of water.
Mhm.
I haven't had any clients that are unable to tolerate it. I've had clients that would fall asleep with the treatments and some that would flinch a little because it feels like warm drops of water,
Mhm.
but it's comfortable. I've done it myself and it's very comfortable.
Okay. Now, when it comes to the treatment sessions, like how many sessions does the average person need when they are doing this type of treatment?
Okay, so it varies. The protocol would be based on what we're treating. So
Mm.
for hyperpigmentation, for example, it may be 6 sessions that would be recommended versus a hair reduction that would be 10 sessions recommended, both which would be spaced like a month apart, 4 to 6 weeks apart.
Mhm. Okay. So 4 to 6 weeks apart, and then anywhere from 6 to 10 sessions. I guess it depends on what they're really looking to get done, right?
It depends on what we're treating. So we
Okay.
have protocols that we follow,
Mhm.
but the average number of treatments would be 6 sessions for correcting most skin conditions.
Okay. And for this Aerolase laser, is it really, I know you mentioned it could do a lot of different things, but does it really specialize in certain situations, whether it's going to be for a condition or a skin tone or anything, or is it really kind of quite broad?
It's very broad. It treats all skin type, 36 different skin concerns, and it's tailored to the individual treatment. So we have our protocol that we follow, whether it's for acne, for example, then
Mhm.
we'd use that protocol based on the person's skin tone,
Mm,
their what we call Fitzpatrick. So we'd select the right setting for that person. So it's pretty broad.
got it. Okay. Now I want to move on to facial balancing. I think for people who are not so familiar with aesthetics may not know what facial balancing is. So could you describe what is facial balancing?
In general, facial balancing is enhancing an individual's appearance based on their specific needs. So we can use hyaluronic acid hyaluronic acid fillers, which is like your Juvederm, and or natural fillers that will help to enhance your features. So we're creating symmetries. So
Mm,
if someone has like sulcan under eyes,
mhm.
we could use the fillers to enhance that. As we age, then our skin or smile line, just to create that perfect natural symmetry.
Okay. So if it's all about symmetry, are there situations where someone comes in and they want to get something done, but you just know if they do that, then it's gonna mess up the symmetry of their face. So you'd recommend against that. Like, do you see that situation where someone wants to make a change and but that would throw things off versus people coming in, they're looking for that symmetry?
Okay. So in general, that's the reason consultation is so essential. So
Mhm.
at our consultation, I'll give my client the mirror. They'll tell their primary concern and goal for the treatment. We would discuss how and what methods we can use to arrive at that, and then together create the perfect treatment plan.
Okay. And within that treatment plan, in your introduction, I mentioned that you do regenerative medicine, also regenerative treatments. So, I guess, how integrative is regenerative medicine into what you do? Is it included in just about everything, or is it like half, or is it kind of a small proportion? What portion of regenerative medicine plays in your treatments?
Regenerative medicine is pretty much where aesthetics is moving. So we include it in most of our treatment plan
Mhm.
and based on the client's needs. So it's the essential, fundamental part of aesthetics now. So
Okay. And for people who don't know what regenerative medicine is, like, what is it like, and how's it different from your regular aesthetic treatments?
I wouldn't say it is different. It's just a form of treatment. So we're using like PRP, for example, to use our natural blood to bring and collagen elastin to, like I mentioned earlier, like natural filler to help to your body to enhance collagen and elastin production versus using like the synthetic hyaluronic acids.
Mhm.
So more of those like natural products to
Mhm.
enhance results.
Got it. Okay. And now, when it comes to these treatments that you provide, I'm sure that you hear a lot of misconceptions or a lot of myths from your clients. So, could you share what are some of those most common misconceptions or myths that you hear from your clients and your patients?
Okay. Because I see a lot of darker skin tones, so there are
Mhm.
a lot of myths like their lasers are not safe for skin of color, and that's not so, because as I said, like the Aerolase gives great results for several different concerns. That's one of the major myths. So, like darker skin tones cannot safely be treated with lasers or chemical peels or the advanced aesthetic treatments modalities. It's the fact is that if it's a safe setting that's adjusted appropriately for the skin tone, then you can safely be treated with most modality.
So it's just the execution, how the treatment is being done, not necessarily the laser itself.
Correct.
Got it.
Or the chemical peel. So much the skincare product, for example, tretinoin is safe in all skin types and tone, but it's just appropriately adjusting any treatment modality to suit the skin type and tone.
Got it. Okay, good to know. Now, Venetia, let's say that somebody is looking to get some type of aesthetic treatment done or procedure done, but they just don't know who to go to. What advice would you give to this person as they're doing their search that they can find that provider who's really good, who has the experience and has the knowledge?
So most of the devices will have trusted providers listed on the website. So say, for example, Aerolase, they'll list certified providers like myself who will safely provide care. So that's a good place to start by researching for the chemical peels. It's the same thing. If you're looking to get a treatment, you could start there by searching by your zip code on the website from the manufacturer.
Okay. And are there any red flags that people should be aware of, that if they see this or hear this, that's like, maybe they should keep looking?
I would say not to get a treatment done without doing a consultation, because we can't do a treatment, create a whole treatment plan for someone without seeing and assessing their skin. So, for example, chemical peel, I would not advise you to go in your first session, do a chemical peel without getting a skin analysis and prep for certain advanced treatments.
Okay. So a consult is always the number one thing to do.
Yeah. So a red flag would be getting treated before a consultation.
Okay.
And a skin assessment. Yeah.
Got it. Okay. What about the quality of product? Is that something that people should be aware of? Like if it's the real product or if they got it from somewhere else that's maybe not official, is that something that people should typically be concerned about or aware of?
When it comes down to selecting products, I would say it is best to consult with a professional like myself versus going on TikTok or going out there and just selecting products because they're trending. Because different skin types, different treatment combination, different chemical combination can be dangerous to the skin. So it's better to consult with a provider and then have them recommend the product. You're safe selecting different brands because there are several brands there, but it's a matter of what's appropriate for your skin concern. Because I've seen several clients that come in with hyperpigmentation, like post-inflammatory inflammation, from using the wrong product or the wrong strength. For example, retinols are a popular one that helps with aging. It's like 9 out of 10 when you select a product for anti-aging, right? But if you're using the higher strength, you're starting it every day like 1% versus starting at 0.25% spaced appropriately, then you can damage your skin versus repairing your skin. So always consultation, education, and being aware of what's appropriate for your skin type, tone, and concern.
Okay. And when it comes to the educational, you mentioned the educational component of it. How do you approach educating your clients and your patients on the benefits of the treatment? So I'm sure that you have a lot of different treatments and there's a lot of different ways that even like the Aerolase can solve a lot of different issues. So how do you approach that educational component with your patients?
So education is a key component for getting the best results. So At the time of consultation, we want to set realistic expectations.
Mhm.
And then at each session, I try to educate on pre-care, like how do you prepare for a treatment, and then post-care. So I'll go over post-care in office, and we'll do a handout. And then I'll also have clients repeat to make sure they understand what's going on. So that's essential.
Mhm.
And each treatment and treatment modality requires different post-care. So at each session, education is constantly a priority.
Okay. And I'm curious, Venetia, what role do you believe creativity plays in how you approach your client care?
Creativity. I don't know if I choose the word creativity, but I do try to do individualized care.
Mhm.
So it is knowledge,
Mhm.
experience, and applying my expertise for each individual person. So not following trend, um, following the protocols, and using experience and expertise to create the perfect plan. And I can't say enough for the individual and the individual concern.
Mhm. Okay.
Yeah.
And what about how important is it to have an artistic eye in what you do?
The artistic eye, that's very helpful, especially when it comes down to facial balancing. It's
Mhm.
like an art. So aesthetics in itself is like an art because
Mhm.
at baseline we have one, so it's like balancing. So
Mhm.
your left versus right may not be perfectly balanced, and we're
Mhm.
always working to create that balance and symmetry. So that plays a key role.
Okay. Now, Venetia, I'm sure that throughout your experience, you've had some memorable cases or maybe even some challenging cases that you've worked on. Is there one story that you can share of just one of those cases that come to mind and how you were able to get them a great result in the end?
Okay. So a common thing that I see, because I do corrective skincare, is that
Mhm.
I've had several clients. That would be one of the consistent thing that I see, that I've been to several different dermatologists. They've tried several different products at home. I mean, I've gotten the outcome that they'd like. And
Mhm.
then with combination treatment, I like to use like the Aerolase combined with other advanced skincare chemical peels, and then we'll get safe, effective, sooner results. So I have one client that has melasma. She's on my Instagram as well. And then she has struggled for several years, trying several different creams, and then just would not get the results that she'd like. So with our consultation, our skin was able to start combination treatment. So we did the Aerolase Laser combined with chemical peels and their home medical skincare regimen.
Mhm.
And after 3 sessions, she got, no, 2 sessions, she got so much improvement. It was more than she got over the years of, going to different specialists and trying different home care regimen and several creams.
Mhm. Wow, that's an impressive story. Okay, well, Venetia, where do you think the future of aesthetics is going?
It's pretty much more natural approach.
Mhm.
So it's not so much more natural approach because we're noticing more natural fillers, more natural balancing versus the trendy, overdone, obvious changes. So it's more balanced, natural approach.
Okay, and you think that's just going to keep going in that direction?
Absolutely. Because I just added to my practice a natural filler because it's something that more clients are asking for, more
Mhm.
natural, enhanced look versus the trendy, overdone
Mm,
appearance.
okay. And with the future in mind, Venetia, what is your vision for your practice?
Okay. So for my practice, I I want to create, I want to leave a legacy, pretty much leave a legacy, much like the Black Trailblazers before that left a marked I want to leave a legacy, much like the Black Trailblazers ahead of me that
Mhm.
made lasting impact, right? So in Middletown, Delaware, there are not a lot of practices that focus on darker skin tones. So I want to create that space where all skin tones will be safely and effectively treated. And especially those of darker skin tones that can be treated safely, that they can feel seen, they can feel comfortable and well taken care of.
Awesome vision you have for the practice. Okay, well, Venetia, I do have one last question for you, but before I ask it, I do want to point people to your website at beautyenhancedmedspa.com. Now,
Yes.
Last question for you, Venetia. What does beauty mean to you?
Beauty is confidence and empowerment. It's when you can look in the mirror and see your reflection showing transformation, restoration, feeling empowered. And for me, as an aesthetic nurse practitioner, it means giving hope by correcting different skin concerns, whether it's from medical conditions like acne or it's from trauma, but enhancing confidence through building confidence through enhancing beauty.
Okay. Well, there you have it. Venetia sharing her expertise. So Venetia, where can people contact you in your practice?
So our direct number is 302-203-9772. You stated the website, and our Instagram is at Beauty Enhanced Med Spa.
Okay. Well, Venetia, this is awesome. Thank you for coming on, and thank you for sharing your message.
Thanks for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.